Hi, Dr. Keith Alexander, talking with you about a very common problem that we see, nasal obstruction and sinusitis. I'm with Kentucky Ear, Nose, and Throat in the Department of Otolaryngology at the Lexington Clinic. Nasal obstruction is and often leads to sinusitis, and it's a very common problem that we see. We can most successfully treat that problem if we can identify what is the underlying factors that are causing it. So I like to think in terms of three. The three biggest causes that lead to nasal obstruction and sinusitis are a physical obstruction in the nose, or allergies, which lead to swelling and obstruction in the nose, or a related condition called vasomotor rhinitis. So if we break that down, if we look at the things that physically obstruct the nose, probably the most common thing is a deviated septum. That's often the result of a prior nasal fracture, but sometimes the nose just develops like that. Oftentimes there's too much cartilage and bone to fit in the space, and so the septum deviates and obstructs the nose. Another common problem that leads to nasal obstruction are polyps in the nose, and those are little benign growths in the nose, usually triggered by allergies, and they can be quite problematic and lead to obstruction of the sinuses as well. Secondly, allergies are very common in central Kentucky. Allergies are when the immune system reacts in a robust way to an irritant in the air that the body recognizes as foreign. So that's often a pollen, a mold, dust, animal dander, even foods that might be in your diet. And we have different ways that we can test you for allergies. We can do a little prick test on the skin. We call those intradermal tests. That's probably the most accurate way to check. But we can also do a blood test if someone is not able to do the skin testing. And then lastly, vasomotor rhinitis is a condition that's very common, very similar to allergies. In fact, sometimes I call it a cousin to allergies because it looks so much like allergies. The nose swells, you get drainage in the throat. It's just that the causes are different. Usually the triggers are environmental, things like changes in barometric pressure, even irritants in the air from cleaning chemicals or colognes or perfumes. In treatment, I like to think of in a three-step approach. We can treat your nasal obstruction with medications, we can treat your allergies, and sometimes we have to resort to surgery. So if we look at those three steps, when we treat sinusitis and nasal obstruction with medicines, oftentimes if there is infection, we do use antibiotics, but we also try to use medicines that shrink the swollen tissue in the nose. So over-the-counter decongestants like Sudafed or Mucinex D are quite helpful. Allergy nasal sprays are helpful for the allergic condition, and those would be things like Nasacort or Flonase or an antihistamine spray called azolastine. We also use rinses to try to keep the nose clean, often with a saline solution, which is buffered salt water, and sometimes we add steroids or antibiotics to that mix as well. The treatment for vasomotor rhinitis and allergies is primarily medical, so we use the antihistamines and the decongestants. For allergies, we often use immunotherapy as well. Immunotherapy is when we take the antigens you're allergic to once we've tested you, and we mix that in a serum, dilute that down, and then give that back to you in the form of a weekly allergy shot or in the form of drops that you put under your tongue. And that then allows your own immune system to build up blocking antibodies, which allow you to become desensitized to the antigens. We can successfully desensitize probably at least 80% of the patients that we treat. So very successful treatment. We use the allergy shots and also the drops under the tongue for various patients. The sublingual drops are very popular because that eliminates the need to come in for a weekly allergy shot, and also is quite popular in children, which of course are not fond of a weekly shot. We also use surgery if the nose is obstructed and we can't clear it with medical management. Surgery often involves correcting a deviated septum, which is a very low-risk outpatient procedure where we straighten the lining, the midline of the nose, so that helps to eliminate obstruction. And then oftentimes surgery involves removing polyps or opening the sinus passages so they can drain more freely. Those are typically done under anesthesia as an outpatient with a fairly quick recovery, where we often have patients back to work in their normal routine after just a couple of days. We would be happy to answer any questions that you have. We'd be happy to see you for an evaluation and get you on the road to recovery. Again, Dr. Keith Alexander with Kentucky Ear, Nose, and Throat Division of the Lexington Clinic.